I'm Jeffrey Fenster, trial attorney, and this is my 6th video in a series called The Nursing Home Guide from Fenster and Cohen Trial Lawyers to help families deal with problems of the elderly in assisted living facilities and in skilled nursing facilities in Florida and nationwide. First question is, what are the problems that I see most commonly in nursing homes? The most common problem in at least the nursing homes that I deal with is understaffing. Remember, there's a registered nurse on the floor who has a nursing license. There's a LPN, licensed practical nurse, who doesn't have the skills that the RN has. And then the most common employee is the CNA, generally a lady born in another country who has the tough job of cleaning up your loved one, taking them to the bathroom, washing them, changing the linens, things of that nature. The most common problem that I see is the result of not having enough employees in these facilities or understaffing. For example, when a resident comes to a Florida nursing home, they have to be assessed at the risk of fall. They have to be assessed at the development of bed sores. There's a thing called the Braden scale, which allows the nursing home to assess whether or not the resident has a risk of developing a bed sore. The way that you avoid bed sores is by lifting the weight off the resident every 2 hours so that the coccyx does not break down. I would say the most common issue in nursing homes is decubitus ulcers and follow-up infection. If you determine that your loved one has developed a decubitus ulcer, do not accept a wound care nurse. Demand that a medical doctor treat your loved one. These facilities generally have related wound care nurses who take a correspondence degree and do nothing for the wound. Ask the facility to transfer your loved one or to call in or to take your loved one to a plastic surgeon or general surgeon that has the ability to treat bed sores. And once the physician has seen them, a treatment plan will happen. The next most common issue is in nursing homes is falls. As I said before, when someone comes into a nursing home, they're assessed at a risk of fall. Make sure that if your loved one is at a risk of fall, that the beds are lowered. Ask the nurses, is there a plan or a protocol called to prevent falling in the facility? And one of the shocking surprises when I tell people is that they're not permitted to use bed rails in nursing homes because it's considered an illegal restraint. So if your loved one has a risk of falls, then you have to ask them to lower the bed, give them things called spanks, make sure there's padding around the facility. Other issues, particularly that I see in assisted living facilities, and I wanted to finish this up. The other issues in nursing homes, elopement, medication errors where they give them the wrong medication or too much, and the most important thing that I see lately is failure to appropriately respond to an unresponsive resident. Lately, I have seen nursing homes where the loved one dies in the nursing home without going to the hospital because she's been neglected, the bell is rung or the call button is pressed, and no one comes. And that's a common issue. So if you happen to come upon your loved one and they're unresponsive, call 911 yourself. You have the right to do it. The last issue is you have the right to bring any physician into the facility. Usually there's a house doctor that works at these facilities who's overworked and underpaid. House doctor. He does not have the best interest of the patient. In fact, most of the time the residents are seen by a nurse practitioner who's overworked and underpaid that works for the overworked and underpaid nursing home doctor. Go find a service. They have visiting physicians that will come to the nursing home. You have a right to bring your own physician to see your mother into the nursing home and to pay for it. Do that to protect your loved one. Other issues concern elopement, walking out the front door into traffic. We've had that. And particularly in memory units. And one other thing I wanted to caution folks about is the memory units in the assisted living facilities. The biggest decision is to move a loved one from an ALF to long-term care in a nursing home. That's a very expensive decision because you go from $2,500 or $3,500 a month to $12,000 a month. And remember, Medicare only provides 100 days. What do you do after that? Well, generally, that's an issue where you have to forfeit your assets and go on Medicaid. That's a subject that I don't want to discuss further. But I think that the most important thing right now is to be aware, be cognizant. The last point I wanted to make is about assisted living facility, lockdown facilities. In Florida, they have what's called memory units in assisted living facilities. These are Alzheimer's patients. In my view, these folks should not be in an assisted living facility, but it's a huge and profitable business in Florida. We've had cases where some of the Alzheimer's residents get violent and actually murder another resident. The care in an assisted living facility is not as good as a nursing home. So when they're in a ALF, don't confuse an assisted living facility with a nursing home. And the lockdown units where you're charged $7,000 to $8,000 a month generally do not provide the protections and the medical care that your loved one would get in a nursing home. These are things to consider. In my next video at Fenster and Cohen Nursing Home Guide, I want to talk to you about hiring an attorney and how the procedures work when you hire an attorney in Florida and probably nationwide. Again, Fenster and Cohen Trial Lawyers.